So what causes heart attacks? Is the cholesterol stupid? Says Dr. William Robert. Now, why will Dr. William call people stupid? Well, you have to understand, he's trying to use the same slogan that the former USA President Bill Clinton used during his 1992 presidential campaign, where he used to say, it's the economy stupid. But when it comes to cholesterol, this guy really knows what he's talking about. Just check this out. He's, of course, American physician specializing in cardiac pathology. He's basically been the master of American College of Cardiology and a leading cardiovascular pathologist. Not only that, he's been an editor for both American Journal of Cardiology and Baylor University Center of Proceedings for decades. Dr. William had written 1,000 scientific publications, and he's written dozen textbooks on cardiology. Now, when he talks about cholesterol and heart disease, this will be an expert who you really need to listen to, because he really knows what he's talking about. So what does he mean it's cholesterol? Let's go into this. You can't miss any second of this. Hi, I'm Dr. Mura, your lifestyle medicine doctor. Now, when it comes to cholesterol, how does elevated level of cholesterol cause coronary artery disease or cause arteriosclerosis, which eventually then causes the issue of heart attacks, strokes, and other cardiovascular diseases? In 2010, American Journal of Cardiology published an article detailing, saying, with the title is the cholesterol is stupid, written by Dr. William Robert. In this article, he argues, giving 4 supporting arguments why cholesterol, while there are other risk factors that may be contributed to atherosclerosis or coronary artery disease. He argues that the cholesterol is the true number one really risk of coronary artery disease. And here is his argument. He argues that atherosclerotic plaques are easily produced when they do experiment in herbivores, that is in rabbits and monkeys, by feeding these animals cholesterol. That is, if you give them food that contains high cholesterol, such as egg yolks, or if you feed these animals saturated fats. The second argument he mentioned is that when you take these animals that would have experimentally give high cholesterol type of diet, you're going to find such cholesterol in the plaques that will be formed in these animals and also, of course, in humans. Argument number 3, he argues that when you check societies, the societies that are subject to high serum cholesterol levels, whether it is total cholesterol or lower density lipoproteins, these societies, when you compare to the other societies that have very low cholesterol, the societies that have high cholesterol, it tend to have high frequency of atherosclerotic events, a high frequency of dying from these events, and large quantity of plaques in their arteries. That's his third argument. The fourth argument is that lowering total LDL cholesterol levels decrease the frequency of atherosclerotic events, which then reduces the chances of dying from these events and the quantity of plaques that may be present in the arteries. So he argues that no one has produced atherosclerosis experimentally by increasing arterial blood pressure or increasing glucose level or by blowing smoke in the faces of rabbits, even for the entire of the their lifetime or causing some stress in these animals. So does then Dr. Robert mean that issues like diabetes, high blood pressure, inactivity cannot contribute to heart attacks, heart disease? No, that's not what really he's talking about. Of course, he goes on to say, this is not to say that the cigarette smoking, increased blood pressure, diabetes mellitus, or obesity and inactivity are not harmful. Of course, they are harmful, but if serum LDL cholesterol is less than 60 milligram per deciliter, or serum total cholesterol is less than 150 milligram per deciliter, there is no evidence, with extremely rare exception, of course, in his view, that these other risk factors cause atherosclerosis. Of course, not to excuse the diabetes, hypertension, and inactivity and so on, but in his view, he points that if you may have all these other diseases, but if you don't have high cholesterol clogging your arteries, you may actually not necessarily have a heart disease. The problem, of course, is these other diseases like diabetes, hypertension. For them to happen, one would have first had the atherosclerosis building up in the arteries leading to that. But his argument also points to the effect, of course, that if you remove cholesterol, then you cannot really be predisposed. At least in 70% of cases, you cannot really suffer coronary artery disease. So, what is your cholesterol numbers, or what is your cholesterol levels? Dr. Roberts found that in order for you to be heart attack proof, you need to get your LDL cholesterol at least under 70 milligram per deciliter. And there are, and he goes on to say that there are only two ways to achieve this. Number one, you can be put on lifetime medication or lifetime medication such as statin or any other type of cholesterol lowering drug. Or you can choose to eat a diet centered around whole plant foods. So what will be your choice? Is it going to be the lifetime medication, or it's going to be, a whole food plant-based diet? Now, when it comes to medication, of course, if you might be suffering from high cholesterol levels, you might have been put on cholesterol-lowering medication. And if you are like many other patients, these medications come with side effects, that may not necessarily be tolerated. So what about rather choosing to eat a diet that has been proven to lower your cholesterol? It does not have any side effects. The only side effects is just you get better. So again, at Dr. Mura Health, we help that transition, talking about whole food plant-based diet. Now, there is also some misconception what is whole food. Of course, being vegetarian is good, being a vegan is good, but vegan or vegetarian does not necessarily mean you center your diet around whole food plants. And that's why we help with the transition. We help monitoring your cholesterol and your blood pressure, because some of these interventions can actually be very, very significant. You may need to lower your medication. That's why you should be in the hands of doctors to care for you. Thank you so much for watching, but I so hope that you're gonna choose the healthier way to eat what is healthy, the diet that is centered around the whole food, and the results will be amazing.